1. Furosemide can cause hypokalemia as a side effect? Answer: true. Rationale: furosemide is a loop diuretic that increases the excretion of sodium, chloride, and water, which can also lead to potassium loss and result in hypokalemia. Monitoring electrolytes is essential during therapy. 2. Aspirin should be taken with food to prevent gastrointestinal irritation? Answer: true. Rationale: aspirin is a nonsteroidal anti-inflammatory drug, NSAID, that can cause GI upset and bleeding. Taking it with food helps minimize these effects. 3. Beta blockers are contraindicated in patients with asthma due to the risk of bronchoconstriction? Answer: true. Rationale: non-selective beta blockers block both beta-1 and beta-2 receptors, and beta-2 blockade in the lungs can cause bronchoconstriction, worsening asthma symptoms. 4. Nifedipine may cause reflex tachycardia as a side effect? Answer: true. Rationale: nifedipine, a calcium channel blocker, can cause vasodilation and a drop in blood pressure, which triggers a compensatory increase in heart rate. 5. Morphine sulfate commonly causes diarrhea as a side effect? Answer: false. Rationale: morphine typically causes constipation by slowing gastrointestinal motility, which is one of its most common side effects. 6. Metformin can cause lactic acidosis in rare cases? Answer: true. Rationale: metformin may accumulate and increase the risk of lactic acidosis, especially in patients with renal impairment. Monitoring renal function is important. 7. Phenytoin toxicity can cause nystagmus and ataxia? Answer: true. Rationale: high levels of phenytoin, an antiepileptic drug, can cause central nervous system side effects such as nystagmus, ataxia, and confusion. 8. Warfarin's therapeutic effect can be reversed by administering vitamin K? Answer: true. Rationale: warfarin is a vitamin K antagonist, and its anticoagulant effect can be reversed with vitamin K in cases of overdose or excessive bleeding. 9. ACE inhibitors are associated with a risk of dry cough due to bradykinin accumulation? Answer: true. Rationale: ACE inhibitors prevent bradykinin breakdown, which can lead to persistent dry cough in some patients. 10. Digoxin toxicity is less likely in patients with hypokalemia? Answer: false. Rationale: hypokalemia increases the risk of digoxin toxicity because low potassium levels enhance digoxin's effects on cardiac muscle. 11. Naloxone is an opioid antagonist used to reverse opioid overdose? Answer: true. Rationale: naloxone binds to opioid receptors and displaces opioid molecules, reversing respiratory depression and sedation. 12. Tetracycline should be taken with milk to improve absorption? Answer: false. Rationale: calcium in milk binds with tetracycline and reduces its absorption. It should be taken on an empty stomach with water. 13. Atorvastatin is best taken in the morning to match the body's cholesterol production? Answer: false. Rationale: statins like atorvastatin are usually more effective when taken in the evening because the liver produces more cholesterol at night. 14. Anticholinergic drugs can cause dry mouth, blurred vision, and urinary retention? Answer: true. Rationale: these drugs block parasympathetic activity, leading to common anticholinergic effects such as dry mouth, blurred vision, and urinary retention. 15. Lithium toxicity can occur with dehydration or sodium depletion. Answer: true. Rationale: lithium is excreted by the kidneys and competes with sodium. Dehydration or low sodium can increase lithium levels, leading to toxicity. 16. Insulin glargine has a peak effect 2 hours after administration? Answer: false. Rationale: insulin glargine is a long-acting insulin with no pronounced peak. It provides a steady level over 24 hours. 17. Gentamicin can cause ototoxicity and nephrotoxicity. Answer: true. Rationale: gentamicin, an aminoglycoside, is associated with toxicity to the kidneys and the ears, requiring close monitoring of drug levels. 18. Ranitidine is a proton pump inhibitor that decreases stomach acid? Answer: false. Rationale: ranitidine is an H2 receptor antagonist, not a PPI. It reduces acid production, but through a different mechanism than PPIs. 19. Albuterol is a beta-2 agonist that causes bronchodilation? Answer: true. Rationale: albuterol stimulates beta-2 receptors in the lungs, relaxing bronchial muscles and improving airflow in conditions like asthma. 20. Heparin is monitored using the International Normalized Ratio, INR? Answer: false. Rationale: heparin's effect is monitored using APTT, activated partial thromboplastin time, whereas INR is used for monitoring warfarin. 21. Ondansetron is used to prevent nausea and vomiting? Answer: true. Rationale: ondansetron is a serotonin receptor antagonist used commonly in chemotherapy, postoperative, and other nausea-inducing conditions. 22. Prednisone may cause hyperglycemia as a side effect? Answer: true. Rationale: corticosteroids like prednisone increase blood glucose by promoting gluconeogenesis and reducing insulin sensitivity. 23. Nitroglycerin can cause headaches due to vasodilation? Answer: true. Rationale: nitroglycerin relaxes blood vessels, which can lead to increased blood flow to the brain and result in headaches. 24. Clopidogrel is used to treat hypertension? Answer: false. Rationale: clopidogrel is an antiplatelet agent used to reduce the risk of stroke or heart attack, not to lower blood pressure. 25. Fluoxetine can increase the risk of serotonin syndrome if combined with MAO inhibitors? Answer: true. Rationale: SSRIs like fluoxetine, when combined with MAOIs, can dangerously elevate serotonin levels, leading to serotonin syndrome. 26. Acetaminophen overdose can cause liver damage? Answer: true. Rationale: high doses of acetaminophen can overwhelm liver metabolism, producing toxic metabolites that cause hepatotoxicity. 27. Epinephrine can cause increased heart rate and blood pressure? Answer: true. Rationale: epinephrine stimulates alpha and beta receptors, resulting in vasoconstriction and increased cardiac output. 28. Diazepam is contraindicated in patients with respiratory depression? Answer: true. Rationale: benzodiazepines depress the central nervous system and can worsen respiratory depression, especially in compromised patients. 29. Lisinopril is a calcium channel blocker? Answer: false. Rationale: lisinopril is an ACE inhibitor that lowers blood pressure by inhibiting the renin-angiotensin system, not by blocking calcium channels. 30. Methotrexate is safe for use during pregnancy? Answer: false. Rationale: methotrexate is a folate antagonist and is contraindicated during pregnancy due to its teratogenic effects. 31. Spironolactone can cause hyperkalemia? Answer: true. Rationale: spironolactone is a potassium-sparing diuretic and can lead to elevated potassium levels, especially in patients with renal impairment. 32. Metoprolol selectively blocks beta-1 receptors in the heart? Answer: true. Rationale: metoprolol is a cardioselective beta blocker that reduces heart rate and contractility by blocking beta-1 receptors. 33. Iron supplements should be taken with calcium for better absorption? Answer: false. Rationale: calcium interferes with iron absorption. Iron is better absorbed on an empty stomach or with vitamin C. 34. Lorazepam can cause sedation and should be used cautiously in the elderly? Answer: true. Rationale: benzodiazepines can cause sedation and increase fall risk, particularly in older adults, due to altered drug metabolism. 35. Isotretinoin requires strict pregnancy prevention due to teratogenicity. Answer: true. Rationale: isotretinoin is highly teratogenic and requires participation in a risk management program for pregnancy prevention. 36. Levothyroxine should be taken at bedtime for best absorption? Answer: false. Rationale: levothyroxine is best absorbed when taken on an empty stomach, typically in the morning before breakfast. 37. Carbamazepine can decrease the effectiveness of oral contraceptives? Answer: true. Rationale: carbamazepine induces liver enzymes, which can increase metabolism of contraceptives and reduce their efficacy. 38. Rivaroxaban requires routine blood test monitoring? Answer: false. Rationale: Unlike warfarin, rivaroxaban does not require routine INR monitoring due to its predictable pharmacokinetics. 39. Amiodarone can cause pulmonary toxicity with long-term use? Answer: true. Rationale: amiodarone has several serious side effects, including pulmonary fibrosis, requiring regular monitoring. 40. Ciprofloxacin should not be taken with antacids? Answer: true. Rationale: antacids can bind to ciprofloxacin and reduce its absorption, leading to subtherapeutic levels. 41. Nalbuphine is a full opioid agonist used for severe pain? Answer: false. Rationale: nalbuphine is a mixed agonist-antagonist opioid and may not be effective for patients with high opioid tolerance. 42. Clonidine is primarily used to treat insomnia? Answer: false. Rationale: clonidine is an alpha-2 agonist used to treat hypertension and occasionally ADHD, not insomnia. 43. Docusate sodium is a stimulant laxative? Answer: false. Rationale: docusate is a stool softener, not a stimulant. It works by increasing water in the stool. 44. Vancomycin should be infused slowly to prevent red man syndrome? Answer: true. Rationale: rapid infusion of vancomycin can cause flushing and hypotension, known as red man syndrome. 45. Glipizide stimulates insulin release from the pancreas? Answer: true. Rationale: glipizide is a sulfonylurea that promotes insulin secretion from functioning pancreatic beta cells. 46. Buspirone has immediate anti-anxiety effects? Answer: false. Rationale: buspirone requires 2 to 4 weeks for full effect and is not useful for acute anxiety attacks. 47. Haloperidol can cause extrapyramidal symptoms? Answer: true. Rationale: haloperidol, a typical antipsychotic, blocks dopamine receptors and is associated with movement-related side effects. 48. Acetazolamide is used to treat glaucoma and altitude sickness? Answer: true. Rationale: acetazolamide reduces aqueous humor production and helps correct metabolic alkalosis at high altitudes. 49. Methadone has a short half-life, requiring frequent dosing? Answer: false. Rationale: methadone has a long half-life, which allows for once or twice daily dosing in most cases. 50. Linezolid should be avoided with foods high in tyramine? Answer: true. Rationale: linezolid is a MAOI-like antibiotic and can cause hypertensive crisis when combined with tyramine-rich foods. 51. Rifampin can cause orange discoloration of bodily fluids? Answer: true. Rationale: rifampin is known to cause orange-red discoloration of urine, sweat, saliva, and tears. This is harmless but can stain clothing and contact lenses. SSRIs like sertraline commonly cause decreased libido, delayed ejaculation, or anorgasmia. 52. Sertraline is an SSRI that may cause sexual dysfunction as a side effect. Answer: true. Rationale: SSRIs like sertraline can cause decreased libido, delayed orgasm, or anorgasmia in both men and women. Thiazide diuretics like HCDZ can cause hypokalemia, not hyperkalemia. 53. Allopurinol should be discontinued at the first sign of a rash? Answer: true. Rationale: a rash may indicate a serious hypersensitivity reaction such as Stevens-Johnson syndrome. Allopurinol should be stopped immediately. Allopurinol is used for long-term prevention of gout, not for acute flare-ups. 54. Amoxicillin should be avoided in patients allergic to penicillin? Answer: true. Rationale: amoxicillin is a penicillin-type antibiotic and may cause cross-reactivity in those allergic to penicillin. Haloperidol, a typical antipsychotic, often causes EPS like tremors, rigidity, and tardive dyskinesia. 55. Nitroglycerin tablets should be swallowed whole for best effect. Answer: false. Rationale: sublingual nitroglycerin should be placed under the tongue to allow rapid absorption into the bloodstream, bypassing the liver. Combining sildenafil and nitrates can lead to life-threatening hypotension. 56. Levodopa-carbidopa may cause darkening of urine and sweat? Answer: true. Rationale: This is a known harmless side effect of the medication used in Parkinson's disease. Levothyroxine can cause weight loss if overreplacement occurs, hyperthyroidism. 57. Bupropion lowers the seizure threshold? Answer: true. Rationale: bupropion can increase the risk of seizures, especially in high doses or in patients with predisposing conditions. Methadone serves as an analgesic and is also used for opioid maintenance therapy. 58. A patient taking MAOIs should avoid foods rich in tyramine? Answer: true. Rationale: tyramine-rich foods can trigger hypertensive crisis when taken with MAOIs due to excess norepinephrine release. The first trimester is the most sensitive period for teratogenic effects on the fetus. 59. Haloperidol is associated with extrapyramidal symptoms, EPS? Answer: true. Rationale: haloperidol, a typical antipsychotic, may cause EPS such as dystonia, Parkinsonism, and akathisia. This harmless side effect is common and should be explained to patients in advance. 60. Sucralfate works by neutralizing stomach acid? Answer: false. Rationale: sucralfate forms a protective barrier over ulcers but does not neutralize acid. It should be taken on an empty stomach. Cephalexin is a cephalosporin, and there is cross-sensitivity with penicillins. 61. Methadone is used in opioid addiction treatment due to its long half-life? Answer: true. Rationale: methadone's long half-life allows for once-daily dosing and helps prevent withdrawal symptoms. Some antibiotics, including amoxicillin, may reduce contraceptive efficacy via GI flora alteration. 62. Enoxaparin is given intramuscularly for rapid anticoagulation? Answer: false. Rationale: enoxaparin, a low-molecular weight heparin, is administered subcutaneously. IM injection may increase the risk of bleeding. INH depletes vitamin B6, pyridoxine, leading to neuropathy. B6 supplementation is often required. 63. A side effect of hydralazine is drug-induced lupus? Answer: true. Rationale: long-term use of hydralazine may lead to a lupus-like syndrome, especially at higher doses. Fluconazole is an antifungal, not an antibacterial drug. 64. Tamsulosin is used to treat hypertension? Answer: false. Rationale: tamsulosin is primarily used to treat benign prostatic hyperplasia, BPH, not hypertension. Sucralfate coats ulcers to protect them from acid, aiding in healing. 65. Vitamin B6, pyridoxine, can reduce peripheral neuropathy caused by isoniazid? Answer: true. Rationale: isoniazid can deplete vitamin B6, leading to neuropathy. Supplementation prevents this. Diltiazem, a calcium channel blocker, treats both blood pressure and heart rhythm disorders. 66. Diltiazem is a calcium channel blocker used for arrhythmias and hypertension? Answer: true. Rationale: diltiazem slows cardiac conduction and relaxes vascular smooth muscle, lowering blood pressure and controlling heart rate. Baclofen works on the CNS to reduce muscle spasticity. 67. Ferrous sulfate can cause constipation and black stools? Answer: true. Rationale: iron supplements often lead to GI side effects, including constipation and dark-colored stools. Loperamide is an antidiarrheal, not a laxative. 68. A serious side effect of clozapine is agranulocytosis? Answer: true. Rationale: clozapine can severely lower WBC count, increasing infection risk. Regular blood monitoring is required. Liver enzymes should be monitored when a patient is on valproic acid. 69. Diphenhydramine can cause drowsiness and should be used cautiously with other CNS depressants? Answer: true. Rationale: diphenhydramine, Benadryl, has sedative effects and may cause additive CNS depression with alcohol or sedatives. Enoxaparin is a low molecular weight heparin administered subcutaneously. 70. Acetazolamide is used to treat glaucoma and altitude sickness? Answer: true. Rationale: acetazolamide is a carbonic anhydrase inhibitor that reduces aqueous humor and helps with altitude acclimatization. Bupropion, especially at high doses, increases seizure risk. 71. Sildenafil should not be taken with nitroglycerin? Answer: true. Rationale. Combining these drugs can cause severe hypotension due to vasodilation. For potassium must never be given as a bolus. It can cause fatal arrhythmias. 72. Methyldopa is safe to use during pregnancy for hypertension? Answer. True. Rationale. Methyldopa is a preferred antihypertensive during pregnancy due to its safety profile. It is a muscle relaxant, commonly used for acute musculoskeletal conditions. 73. Baclofen is a muscle relaxant that may cause drowsiness and dizziness? Answer. True. Rationale. Baclofen acts on the central nervous system and may cause sedation and impaired coordination. NMS is a rare but life-threatening side effect characterized by fever, rigidity, and altered mental status. 74. Propylthiouracil, PTU, is used to treat hyperthyroidism? Answer. True. Rationale. PTU inhibits thyroid hormone synthesis and is often used in thyroid storm or pregnancy. Tamsulosin relaxes smooth muscle in the prostate and bladder neck, improving urine flow. 75. A side effect of isoniazid is hepatotoxicity? Answer. True. Rationale. Isoniazid can cause liver damage. Liver enzymes should be monitored during therapy. It restores glutathione and prevents liver damage when given promptly. 76. Varenicline is used to manage nicotine withdrawal? Answer. True. Rationale. Varenicline, Chantix, is a partial nicotine receptor agonist used for smoking cessation. Common anticholinergic effects of diphenhydramine, Benadryl. 77. Misoprostol is contraindicated in pregnancy? Answer. True. Rationale. Misoprostol can induce uterine contractions and cause miscarriage. Buspirone has minimal sedative effects and no dependency potential. 78. Omeprazole is a proton pump inhibitor that decreases gastric acid production? Answer. True. Rationale. Omeprazole irreversibly inhibits gastric proton pumps, reducing acid secretion. Fatal precipitates may form. Avoid mixing in neonates. 79. Alendronate should be taken with food to prevent stomach upset? Answer. False. Rationale. Alendronate must be taken on an empty stomach with water. Food interferes with absorption. A nitrate-free interval, e.g., overnight, is needed to prevent tolerance. 80. Dextromethorphan is a cough suppressant found in many OTC products? Answer. True. Rationale. It acts on the cough center in the medulla to suppress coughing. Used for alcohol aversion therapy, it causes nausea, flushing, and palpitations with alcohol intake. 81. Trazodone is primarily used to treat insomnia at low doses? Answer. True. Rationale. Though an antidepressant, its sedating effects make it useful for insomnia at lower doses. Codeine is metabolized variably, and some individuals may convert it rapidly to morphine. 82. Mannitol is contraindicated in patients with heart failure? Answer. True. Rationale. Mannitol increases plasma volume, which may worsen heart failure. Especially in the elderly or those on steroids, fluoroquinolones can weaken tendons. 83. Lactulose is used to treat hepatic encephalopathy by reducing ammonia levels? Answer. True. Rationale. Lactulose traps ammonia in the colon and facilitates its excretion. Loratadine is a non-sedating antihistamine, unlike first-gen antihistamines. 84. Cyclobenzaprine is a centrally acting skeletal muscle relaxant? Answer. True. Rationale. It reduces muscle spasms by acting on the brainstem. It can disrupt gut flora, allowing C. difficile overgrowth. 85. Ethambutol can cause optic neuritis? Answer. True. Rationale. Visual disturbances, especially loss of red-green discrimination, are possible with ethambutol. One of the most common side effects is decreased appetite and potential weight loss. 86. Dronabinol is a synthetic cannabinoid used to stimulate appetite in HIV/AIDS patients? Answer. True. Rationale. It helps treat anorexia and weight loss by increasing appetite. Omeprazole is a proton pump inhibitor, PPI, not an H2 blocker. 87. Theophylline has a narrow therapeutic range and requires regular monitoring? Answer. True. Rationale. Therapeutic levels are narrow. 5 to 15 mg/ml. Toxicity can cause arrhythmias and seizures. Calcium in dairy reduces iron absorption. Take iron with vitamin C instead. 88. Raloxifene is used to treat osteoporosis in men. Answer: false. Rationale: raloxifene is approved for use in postmenopausal women, not men. Patches are for chronic pain in opioid-tolerant patients due to overdose risk. 89. Colchicine is used to treat acute gout attacks. Answer: true. Rationale: colchicine reduces inflammation and pain during acute gout flare-ups. It's a cholinesterase inhibitor that may improve cognition or delay decline. 90. Magnesium sulfate toxicity may cause respiratory depression and loss of reflexes. Answer: true. Rationale: high levels depress the central nervous system and require calcium gluconate as an antidote. Monitor ECG if patient has cardiac risks. Macrolides can prolong QT interval. 91. Sumatriptan is used to prevent migraines from occurring. Answer: false. Rationale: sumatriptan is used to abort acute migraines, not prevent them. Propofol is a sedative/anesthetic, not associated with psychosis. 92. Ketorolac is a potent NSAID that should not be used long-term. Answer: true. Rationale: risk of GI bleeding and renal toxicity limits use to 5 days or less. It is a urinary analgesic, not an antibiotic, used for symptom relief. 93. Timolol eye drops are used to lower intraocular pressure in glaucoma. Answer: true. Rationale: timolol is a beta blocker that reduces aqueous humor production. A common nickname for this side effect is Dopamax. 94. Finasteride is used to treat male pattern baldness and BPH. Answer: true. Rationale: it inhibits 5-alpha reductase, reducing DHT levels. Can cause hypertensive crisis if diet isn't controlled. 95. Epoetin alpha may increase the risk of hypertension and thromboembolism. Answer: true. Rationale: it stimulates RBC production, which may raise hematocrit and blood pressure. It's a synthetic erythropoietin used in anemia, especially in CKD. 96. Metoclopramide may cause tardive dyskinesia with long-term use. Answer: true. Rationale: it blocks dopamine receptors, which can lead to extrapyramidal side effects. Clozapine is reserved for treatment-resistant cases due to risk of agranulocytosis. 97. Linezolid can cause serotonin syndrome if combined with SSRIs. Answer: true. Rationale: linezolid is a weak MALI and can interact with serotonergic drugs. It's an alpha-glucosidase inhibitor used in diabetes management. 98. Loperamide is used to treat diarrhea by slowing intestinal motility. Answer: true. Rationale: loperamide acts on opioid receptors in the gut, reducing peristalsis. Given to mothers at risk for preterm delivery to promote surfactant production. 99. Desmopressin is used to treat diabetes insipidus and nocturnal enuresis. Answer: true. Rationale: it mimics ADH, reducing urine production in central DI and bedwetting. It relaxes skeletal muscle and treats this life-threatening reaction. 100. Rosuvastatin is primarily used to raise HDL cholesterol. Answer: false. Rationale: rosuvastatin mainly lowers LDL cholesterol. It may modestly increase HDL, but that's not its primary effect. Patients should avoid alcohol during and 48 hours after taking it. 101. Ondansetron is used to treat nausea and vomiting caused by chemotherapy. Answer: true. Rationale: ondansetron is a 5-HT3 receptor antagonist effective against chemotherapy-induced nausea and vomiting. 102. Phenytoin can cause gingival hyperplasia as a side effect. Answer: true. Rationale: long-term use of phenytoin can cause overgrowth of the gums. Good oral hygiene is essential. 103. Flumazenil is used to reverse opioid overdose. Answer: false. Rationale: flumazenil is a benzodiazepine antagonist. Naloxone is used to reverse opioid overdose. 104. Ciprofloxacin can cause tendon rupture, especially in older adults. Answer: true. Rationale: Fluoroquinolones like ciprofloxacin have a black box warning for tendinitis and tendon rupture. 105. Warfarin should be avoided during pregnancy? Answer: true. Rationale: warfarin crosses the placenta and can cause fetal abnormalities. Heparin is preferred in pregnancy. 106. Nifedipine is a beta blocker used for angina? Answer: false. Rationale: nifedipine is a calcium channel blocker, not a beta blocker. It is used for angina and hypertension. 107. Isotretinoin is contraindicated during pregnancy due to teratogenicity? Answer: true. Rationale: isotretinoin can cause severe birth defects. Patients must use 2 forms of contraception. 108. Heparin works by inhibiting platelet aggregation? Answer: false. Rationale: heparin enhances antithrombin 3 activity, inhibiting clotting factors Ia and Xa, not platelets. 109. Aspirin in children with viral infections can cause Reye's syndrome? Answer: true. Rationale: aspirin is avoided in children due to the risk of Reye's syndrome when used with viral illness. 110. Vancomycin infusion should be given rapidly to maximize effectiveness? Answer: false. Rationale: rapid infusion can cause red man syndrome. It should be infused over at least 60 minutes. 111. Carbamazepine can cause bone marrow suppression? Answer: true. Rationale: it may lead to agranulocytosis or aplastic anemia. Monitor CBC regularly. 112. Spironolactone may cause hyperkalemia? Answer: true. Rationale: as a potassium-sparing diuretic, spironolactone increases serum potassium levels. 113. Methotrexate is a chemotherapy agent that can also be used to treat rheumatoid arthritis? Answer: true. Rationale: low-dose methotrexate is commonly used as a DMARD for autoimmune conditions. 114. Atropine is used to treat bradycardia? Answer: true. Rationale: atropine increases heart rate by blocking the parasympathetic nervous system. 115. Digoxin increases heart rate and cardiac output? Answer: false. Rationale: digoxin slows the heart rate but increases contractility, improving cardiac output. 116. Clindamycin may cause pseudomembranous colitis? Answer: true. Rationale: clindamycin is associated with C. difficile overgrowth, leading to colitis. 117. Lithium has a wide therapeutic index and rarely requires monitoring? Answer: false. Rationale: lithium has a narrow therapeutic range, 0.6 to 1.2 milliequivalent/L. Regular blood level monitoring is essential. 118. NSAIDs may reduce the effectiveness of antihypertensive medications? Answer: true. Rationale: NSAIDs can cause sodium retention and vasoconstriction, reducing antihypertensive effects. 119. A side effect of amiodarone is pulmonary toxicity. Answer: true. Rationale: long-term use of amiodarone can cause interstitial lung disease or pulmonary fibrosis. 120. Terbutaline is a beta agonist used to delay preterm labor? Answer: true. Rationale: terbutaline relaxes uterine smooth muscle, but is used short-term due to cardiovascular risks. 121. Furosemide may cause ototoxicity if given too rapidly? Answer: true. Rationale: rapid administration of high doses of furosemide can damage hearing. 122. Clopidogrel is an antiplatelet agent used to prevent clot formation? Answer: true. Rationale: clopidogrel inhibits platelet aggregation and is used post-MI or post-stent placement. 123. Glipizide can cause hypoglycemia? Answer: true. Rationale: as a sulfonylurea, glipizide stimulates insulin release and may lower blood sugar excessively. 124. Salmeterol is a short-acting beta agonist used for acute asthma attacks? Answer: false. Rationale: salmeterol is a long-acting beta agonist and should not be used for acute symptoms. 125. Acyclovir is used to treat viral infections such as herpes simplex? Answer: true. Rationale: acyclovir inhibits viral DNA synthesis in herpes infections. 126. Prednisone must be tapered to avoid adrenal insufficiency? Answer: true. Rationale: Long-term corticosteroid use suppresses the adrenal glands, tapering allows recovery. 127. Metformin increases the risk of lactic acidosis in patients with renal impairment? Answer: true. Rationale: metformin is contraindicated in severe renal dysfunction due to lactic acidosis risk. 128. Naloxone is a benzodiazepine antidote? Answer: false. Rationale: naloxone is an opioid antagonist. Flumazenil is used for benzodiazepine overdose. 129. Levothyroxine is used to treat hyperthyroidism? Answer: false. Rationale: levothyroxine is used to treat hypothyroidism by replacing thyroid hormone. 130. Adverse effects of corticosteroids include hyperglycemia and osteoporosis? Answer: true. Rationale: chronic use leads to metabolic changes including high blood sugar and bone loss. 131. Lamotrigine can cause a life-threatening rash? Answer: true. Rationale: it may cause Stevens-Johnson syndrome. The drug should be discontinued if rash appears. 132. Metronidazole should not be taken with alcohol? Answer: true. Rationale: combining the two may cause a disulfiram-like reaction, flushing, vomiting, etc. 133. Codeine can cause constipation? Answer: true. Rationale: opioids reduce gut motility, leading to constipation. 134. Aspirin has anticoagulant properties? Answer: true. Rationale: aspirin inhibits platelet aggregation via COX-1 inhibition, increasing bleeding risk. 135. A major side effect of statins is hepatotoxicity and muscle pain? Answer: true. Rationale: statins can raise liver enzymes and cause myopathy or rhabdomyolysis. 136. Buspirone has sedative effects and is used PRN for anxiety? Answer: false. Rationale: buspirone does not cause sedation and must be taken consistently, not PRN. 137. Propranolol may mask symptoms of hypoglycemia? Answer: true. Rationale: beta blockers can mask signs like tachycardia and tremors in diabetics. 138. Teratogenic drugs are always safe during the second trimester? Answer: false. Rationale: some teratogenic effects can occur throughout pregnancy, depending on the drug. 139. Neostigmine is used to reverse neuromuscular blockade? Answer: true. Rationale: neostigmine increases acetylcholine levels, reversing non-depolarizing muscle relaxants. 140. Disulfiram discourages alcohol use by causing unpleasant symptoms if alcohol is consumed? Answer: true. Rationale: disulfiram blocks acetaldehyde breakdown, causing nausea and palpitations with alcohol. 141. Benztropine is used to treat tremors in Parkinson's disease? Answer: true. Rationale: benztropine is an anticholinergic that helps reduce tremor and rigidity. 142. Tetracycline should be taken with milk or antacids to reduce GI upset. Answer: false. Rationale: calcium and magnesium interfere with absorption. It should be taken on an empty stomach. 143. Erythropoietin-stimulating agents are given to dialysis patients to treat anemia? Answer: true. Rationale: these agents stimulate RBC production in patients with chronic kidney disease. 144. Celecoxib is a non-selective NSAID? Answer: false. Rationale: celecoxib selectively inhibits COX-2, reducing inflammation with less GI irritation. 145. Dopamine at low doses increases renal perfusion? Answer: true. Rationale: low-dose dopamine dilates renal vessels, improving kidney perfusion. 146. Bimatoprost is used for treating dry eyes? Answer: false. Rationale: bimatoprost reduces intraocular pressure in glaucoma. It is not used for dry eyes. 147. Chlorpromazine may cause photosensitivity. Answer: true. Rationale: patients should avoid prolonged sun exposure due to increased sensitivity. 148. A side effect of SSRIs is serotonin syndrome when combined with other serotonergic drugs? Answer: true. Rationale: SSRIs can lead to serotonin syndrome, especially with amylase, triptans, or tramadol. 149. Phenazopyridine is used to treat urinary tract infections directly? Answer: false. Rationale: it is a urinary analgesic that relieves pain but does not treat infection. 150. Lactated Ringer's solution contains potassium and should be used cautiously in hyperkalemia? Answer: true. Rationale: LR contains potassium and may worsen hyperkalemia in at-risk patients. 151. Chlorpheniramine is an antihistamine that can cause drowsiness. Answer: true. Rationale: as a first-generation antihistamine, chlorpheniramine can cross the blood-brain barrier and cause sedation. 152. Ketorolac can be used for long-term pain management. Answer: false. Rationale: ketorolac is a potent NSAID intended for short-term use only due to risk of GI bleeding and renal issues. 153. Sildenafil should not be taken with nitrates due to risk of severe hypotension. Answer: true. Rationale: both cause vasodilation, which can dangerously drop blood pressure when used together. 154. Valproic acid may cause hepatotoxicity and pancreatitis. Answer: true. Rationale: serious side effects include liver toxicity and pancreatitis. Liver function should be monitored. 155. Ranitidine is a proton pump inhibitor. Answer: false. Rationale: ranitidine is an H2 receptor antagonist, not a PPI. It reduces stomach acid production differently. 156. Isoniazid can cause peripheral neuropathy. Answer: true. Rationale: isoniazid depletes vitamin B6, leading to neuropathy unless supplemented. 157. Sertraline can cause sexual dysfunction as a side effect. Answer: true. Rationale: SSRIs commonly cause decreased libido and sexual dysfunction. 158. Bupropion is safe for use in patients with a history of seizures. Answer: false. Rationale: bupropion lowers seizure threshold and should be avoided in such patients. 159. Clonidine can cause rebound hypertension if stopped abruptly. Answer: true. Rationale: clonidine should be tapered slowly to prevent a rapid increase in blood pressure. 160. Rifampin may cause orange discoloration of body fluids. Answer: true. Rationale: this is a harmless but common effect. Patients should be informed. 161. Docusate sodium is a stimulant laxative. Answer: false. Rationale: docusate is a stool softener, not a stimulant laxative. 162. Tamsulosin is used to treat symptoms of BPH. Answer: true. Rationale: it relaxes smooth muscle in the prostate and bladder neck, improving urine flow. 163. Tramadol is a strong opioid that causes respiratory depression. Answer: false. Rationale: tramadol is a weak opioid agonist and less likely to cause respiratory depression than stronger opioids. 164. Hydroxychloroquine can cause retinal damage with long-term use. Answer: true. Rationale: regular eye exams are recommended due to the risk of irreversible vision loss. 165. A side effect of alendronate is esophagitis. Answer: true. Rationale: alendronate can irritate the esophagus. Patients should take it with water and remain upright. 166. Allopurinol increases uric acid levels in the blood. Answer: false. Rationale: allopurinol reduces uric acid production and is used to treat gout. 167. Acetaminophen overdose can cause liver failure. Answer: true. Rationale: excessive doses can be hepatotoxic. Antidote is N-acetylcysteine. 168. Methyldopa is commonly used to treat hypertension in pregnancy. Answer: true. Rationale: methyldopa is considered safe for use during pregnancy. 169. Loperamide is used to treat constipation. Answer: false. Rationale: loperamide slows intestinal movement and is used to treat diarrhea. 170. Amoxicillin is contraindicated in penicillin-allergic patients. Answer: true. Rationale: amoxicillin is a penicillin derivative and may cause an allergic reaction. 171. Lactulose is used to treat hepatic encephalopathy. Answer: true. Rationale: It reduces ammonia levels by promoting bowel movements. 172. Methylphenidate is a stimulant used in ADHD treatment. Answer: true. Rationale: it increases dopamine and norepinephrine activity in the brain. 173. Baclofen is a muscle relaxant that can cause CNS depression. Answer: true. Rationale: side effects include drowsiness, dizziness, and weakness. 174. Iron supplements should be taken with dairy for better absorption. Answer: false. Rationale: calcium in dairy inhibits iron absorption. Vitamin C enhances it. 175. Enoxaparin is a low molecular weight heparin used to prevent blood clots. Answer: true. Rationale: it is given subcutaneously for DVT and PE prevention. 176. A side effect of haloperidol is extrapyramidal symptoms. Answer: true. Rationale: haloperidol is a typical antipsychotic with a high risk of EPS. 177. Ethambutol may cause red-green color blindness. Answer: true. Rationale: it can cause optic neuritis. Vision should be monitored. 178. Sucralfate coats ulcers and prevents further injury. Answer: true. Rationale: it forms a protective barrier over gastric ulcers. 179. Levothyroxine should be taken with food for best absorption. Answer: false. Rationale: it should be taken on an empty stomach for better absorption. 180. Gabapentin is used to treat neuropathic pain. Answer: true. Rationale: it is commonly prescribed for nerve-related pain and seizures. 181. Diphenhydramine can cause anticholinergic effects like dry mouth and urinary retention. Answer: true. Rationale: as a first-gen antihistamine, it has strong anticholinergic properties. 182. Omeprazole can cause long-term hypomagnesemia. Answer: true. Rationale: prolonged use of PPIs may lead to low magnesium levels. 183. Metoclopramide increases gastrointestinal motility. Answer: true. Rationale: it enhances GI motility and is used for gastroparesis and nausea. 184. Nitroprusside is used to increase blood pressure rapidly. Answer: false. Rationale: it is a potent vasodilator used to lower blood pressure in hypertensive emergencies. 185. Mannitol is used to decrease intracranial pressure. Answer: true. Rationale: mannitol is an osmotic diuretic that reduces brain swelling. 186. Teratogenic drugs should be avoided during breastfeeding. Answer: true. Rationale: some drugs can pass into breast milk and harm the baby. 187. Anticholinergic drugs cause increased secretions and bradycardia. Answer: false. Rationale: anticholinergics reduce secretions and increase heart rate. 188. Nitroglycerin patches should be worn 24/7 for effectiveness. Answer: false. Rationale: patches require a nitrate-free interval, e.g., remove at night, to prevent tolerance. 189. A common side effect of SSRIs is weight gain. Answer: true. Rationale: SSRIs may cause weight gain with long-term use. 190. Prochlorperazine is an antiemetic used to treat nausea. Answer: true. Rationale: it blocks dopamine receptors in the brain's vomiting center. 191. Timolol is a beta blocker used in eye drops to treat glaucoma. Answer: true. Rationale: it reduces intraocular pressure by decreasing aqueous humor production. 192. Tetracycline is safe for use in children under 8 years old. Answer: false. Rationale: it can cause permanent teeth discoloration and is avoided in young children. 193. An adverse effect of olanzapine is weight loss. Answer: false. Rationale: olanzapine is associated with weight gain and metabolic syndrome. 194. Finasteride is used to treat both BPH and male pattern baldness. Answer: true. Rationale: it blocks conversion of testosterone to DHT, reducing prostate size and hair loss. 195. Lisinopril is associated with a dry cough in some patients. Answer: true. Rationale: ACE inhibitors can increase bradykinin, causing a persistent cough. 196. Buspirone has a rapid onset of action for anxiety relief. Answer: false. Rationale: it may take 1 to 2 weeks for therapeutic effects to appear. 197. Misoprostol can cause uterine contractions and is contraindicated in pregnancy. Answer: true. Rationale: it is used to induce labor or abortions, should not be used to treat ulcers in pregnant women. 198. Montelukast is a leukotriene receptor antagonist used for asthma prophylaxis. Answer: true. Rationale: it helps prevent asthma attacks, but is not used for acute treatment. 199. Ciprofloxacin should not be taken with dairy products or antacids. Answer: true. Rationale: calcium, magnesium, and aluminum can bind the drug and reduce absorption. 200. Phenobarbital is a barbiturate that may cause sedation and respiratory depression. Answer: true. Rationale: as a CNS depressant, it can reduce consciousness and breathing, especially in overdose. 201. Simvastatin should be taken with food for best absorption. Answer: false. Rationale: simvastatin is best absorbed when taken in the evening, and food does not significantly impact its absorption. 202. Furosemide can cause hypokalemia. Answer: true. Rationale: furosemide is a loop diuretic that increases potassium excretion, potentially leading to low potassium levels. 203. Celecoxib is a nonsteroidal anti-inflammatory drug, NSAID, that does not affect platelet function. Answer: true. Rationale: celecoxib is a COX-2 inhibitor that has a lower risk of gastrointestinal bleeding and does not affect platelet aggregation. 204. Methotrexate is an immunosuppressive drug commonly used to treat rheumatoid arthritis. Answer: true. Rationale: methotrexate suppresses immune function and reduces inflammation in conditions like rheumatoid arthritis. 205. Diazepam is contraindicated in patients with a history of alcohol use disorder. Answer: true. Rationale: diazepam, a benzodiazepine, can enhance the depressant effects of alcohol, increasing the risk of overdose. 206. Prednisone is a corticosteroid that can cause weight loss. Answer: false. Rationale: prednisone typically causes weight gain due to fluid retention and increased appetite. 207. Lorazepam is a short-acting benzodiazepine used to treat anxiety. Answer: true. Rationale: lorazepam is effective for short-term anxiety relief due to its rapid onset and relatively short duration of action. 208. Digoxin can cause bradycardia in patients with a high serum concentration. Answer: true. Rationale: digoxin slows the heart rate, and high serum levels increase the risk of bradycardia and arrhythmias. 209. Spironolactone is a potassium-sparing diuretic that may cause hyperkalemia. Answer: true. Rationale: spironolactone blocks aldosterone, reducing potassium excretion, which can lead to elevated potassium levels. 210. Phenytoin is an anticonvulsant drug that may cause gingival hyperplasia. Answer: true. Rationale: phenytoin can cause overgrowth of gum tissue as a side effect. 211. Metformin can cause hypoglycemia in patients not taking insulin. Answer: false. Rationale: metformin works by improving insulin sensitivity and does not typically cause hypoglycemia unless combined with insulin or sulfonylureas. 212. Heparin is used to treat hypercoagulable states and prevents thrombus formation. Answer: true. Rationale: heparin inhibits clotting factors, preventing blood clot formation. 213. The combination of propranolol and verapamil increases the risk of severe bradycardia. Answer: true. Rationale: both drugs can slow heart rate. Their combined use can dangerously decrease heart rate and blood pressure. 214. Amiodarone is used to treat arrhythmias, but it may cause thyroid dysfunction. Answer: true. Rationale: amiodarone can interfere with thyroid function due to its high iodine content. 215. Diphenhydramine is safe for use during pregnancy. Answer: false. Rationale: although considered relatively safe, diphenhydramine should be used cautiously during pregnancy, especially in the first trimester. 216. The use of lithium in patients with dehydration increases the risk of toxicity. Answer: true. Rationale: dehydration can cause increased lithium levels in the blood, increasing the risk of toxicity. 217. A common side effect of verapamil is constipation. Answer: true. Rationale: verapamil is a calcium channel blocker that can slow gastrointestinal motility, leading to constipation. 218. Glipizide is a sulfonylurea used to lower blood sugar in type 1 diabetes. Answer: false. Rationale: glipizide is used in type 2 diabetes to increase insulin release, but is not effective in type 1 diabetes. 219. A major side effect of methadone is respiratory depression. Answer: true. Rationale: methadone is a long-acting opioid that can cause respiratory depression, especially at higher doses. 220. Vancomycin is an antibiotic used to treat infections caused by gram-negative bacteria. Answer: false. Rationale: vancomycin is effective against gram-positive bacteria, such as MRSA, but not against gram-negative organisms. 221. Isotretinoin is a retinoid that is contraindicated in pregnant women due to teratogenic effects. Answer: true. Rationale: isotretinoin is known to cause birth defects and should not be used during pregnancy. 222. Baclofen is used to treat spasticity in patients with multiple sclerosis. Answer: true. Rationale: baclofen is a muscle relaxant that can reduce spasticity and improve mobility in patients with multiple sclerosis. 223. The use of acyclovir during pregnancy is contraindicated. Answer: false. Rationale: acyclovir is considered safe during pregnancy and is used to treat herpes simplex and varicella zoster infections. 224. The combination of atenolol and clonidine can cause excessive bradycardia. Answer: true. Rationale: both drugs lower heart rate, and when taken together, they can significantly reduce heart rate to dangerous levels. 225. Theophylline toxicity can cause seizures and arrhythmias. Answer: true. Rationale: theophylline, used to treat asthma, has a narrow therapeutic range and toxicity can lead to seizures and life-threatening arrhythmias. 226. A side effect of prednisone is adrenal suppression. Answer: true. Rationale: long-term use of prednisone can suppress the body's ability to produce corticosteroids, leading to adrenal insufficiency. 227. Lisinopril can cause hyperkalemia as a side effect. Answer: true. Rationale: lisinopril, an ACE inhibitor, can reduce aldosterone, leading to decreased potassium excretion and hyperkalemia. 228. Warfarin is an anticoagulant that works by inhibiting vitamin K-dependent clotting factors. Answer: true. Rationale: warfarin inhibits the synthesis of clotting factors 2, 7, 9, and X, which require vitamin K for activation. 229. Aspirin should not be used in children with viral infections due to the risk of Reye syndrome. Answer: true. Rationale: aspirin has been linked to Reye syndrome, a rare but serious condition that can cause liver damage and encephalopathy in children. 230. Dextromethorphan is an opioid used to treat cough. Answer: false. Rationale: dextromethorphan is a non-opioid cough suppressant that works by suppressing the cough reflex. 231. Hydrochlorothiazide is a thiazide diuretic that may cause hypokalemia. Answer: true. Rationale: thiazide diuretics increase potassium excretion, potentially causing hypokalemia. 232. Clopidogrel is an anticoagulant used to prevent blood clots after surgery. Answer: false. Rationale: clopidogrel is an antiplatelet drug, not an anticoagulant, used to prevent thrombus formation by inhibiting platelet aggregation. 233. Carbamazepine can cause hyponatremia as a side effect. Answer: true. Rationale: carbamazepine, an anticonvulsant, can cause sodium retention, leading to low sodium levels. 234. Albuterol is a beta-2 agonist used to treat asthma exacerbations. Answer: true. Rationale: albuterol works by relaxing the bronchial smooth muscle, improving airflow, and relieving asthma symptoms. 235. Dantrolene is used to treat malignant hyperthermia. Answer: true. Rationale. Dantrolene is a muscle relaxant that treats malignant hyperthermia by inhibiting calcium release from muscle cells. 236. Terazosin is used to treat high blood pressure and benign prostatic hyperplasia. Answer: true. Rationale. Terazosin is an alpha-1 blocker that relaxes blood vessels and the smooth muscle of the prostate. 237. Insulin glargine is a rapid-acting insulin used to treat hyperglycemia. Answer: false. Rationale. Insulin glargine is a long-acting insulin, providing a steady level of insulin throughout the day. 238. The use of vancomycin can lead to red man syndrome. Answer: true. Rationale. Rapid infusion of vancomycin can cause a histamine reaction, leading to flushing and rash, known as red man syndrome. 239. Rifampin can cause liver toxicity and should be monitored. Answer: true. Rationale. Rifampin can cause hepatotoxicity and liver function should be regularly assessed during treatment. 240. Nifedipine is a calcium channel blocker that can be used to treat hypertension and angina. Answer: true. Rationale. Nifedipine relaxes smooth muscles, lowering blood pressure and improving blood flow to the heart. 241. Diphenhydramine is effective as a sleep aid for chronic insomnia. Answer: false. Rationale. Although diphenhydramine can cause drowsiness, it is not recommended for chronic insomnia due to its anticholinergic effects and potential for tolerance. 242. Insulin is used to treat both type 1 and type 2 diabetes. Answer: true. Rationale. Insulin is primarily used in type 1 diabetes and can be used in type 2 when oral medications are insufficient. 243. Metoclopramide is used to treat nausea and vomiting, but it can cause tardive dyskinesia. Answer: true. Rationale. Metoclopramide increases gastric motility and reduces nausea, but long-term use can lead to movement disorders like tardive dyskinesia. 244. Bupropion can be used to treat depression, smoking cessation, and as an adjunct for weight loss. Answer: true. Rationale. Bupropion is used for depression, smoking cessation, and weight loss, but it can lower the seizure threshold. 245. Ethambutol is an antibiotic used to treat tuberculosis. Answer: true. Rationale. Ethambutol is used in combination with other drugs to treat tuberculosis, and it can cause optic neuropathy as a side effect. 246. Cimetidine is a histamine 2 blocker that reduces stomach acid production. Answer: true. Rationale. Cimetidine inhibits histamine receptors, reducing stomach acid secretion, useful in treating ulcers and GERD. 247. The use of nitrates can cause hypotension, especially when combined with erectile dysfunction drugs. Answer: true. Rationale. Nitrates dilate blood vessels, lowering blood pressure, and combining them with erectile dysfunction drugs like sildenafil can lead to severe hypotension. 248. The use of zolpidem is recommended for long-term treatment of insomnia. Answer: false. Rationale. Zolpidem is intended for short-term use due to its potential for dependence and tolerance. 249. The main side effect of sildenafil is headaches. Answer: true. Rationale. Sildenafil can cause vasodilation, leading to common side effects like headaches. 250. Azithromycin is a macrolide antibiotic used to treat bacterial infections. Answer: true. Rationale. Azithromycin works by inhibiting bacterial protein synthesis and is used to treat respiratory and other infections.